Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
Welcome to another episode in our podcast series, Ask the Expert. Emerging evidence to improve outcomes in vitiligo. My name is Dr. Raj Chovatiya. I'm a clinical associate professor at the Rosalind University Chicago Medical School and founder and director of the Center for Medical Dermatology and Immunology Research in Chicago. My clinical and research interests are primarily centered on the intricate relationship between cutaneous immunology and inflammatory skin disorders. Today, we're discussing a topic that's essential to effective vitiligo management: shared decision-making. This episode is titled Vitiligo, No Decision About Me Without Me, and we'll explore why it's so important for patients to be involved in their treatment plans. I'm joined by one of my patients, Casey, who will share his experience of how being involved in the decision-making process has impacted his journey with vitiligo. Casey, thanks so much for joining us.
Hi, Dr. Raj. Thanks for inviting me to join this podcast.
Before we start, I just want to provide our listeners with a little bit of background information on vitiligo. Vitiligo is a chronic, inflammatory, autoimmune condition characterized by the gradual loss of pigment in the skin, leading to depigmented and white patches that can appear practically anywhere on the body. This condition affects individuals in diverse ways, impacting not only their physical appearance, but also their emotional well-being. The unpredictability of vitiligo can complicate treatment. Its manifestations can vary widely from one patient to another. Some can experience localized patches, while some more broad, some on the face, some on the hands, and some even on the trunk. The rate of progression can also differ significantly, and this can leave patients very uncertain about what the future holds for their condition. Therefore, managing vitiligo transcends merely identifying first the disease and even the right treatment. It really involves making an environment where patients are comfortable, feel in control of their care. Healthcare providers also feel comfortable and in control of their ability to make suggestions, and really empowering all parties from providing comprehensive information about the condition, actively involving one another in decision-making process, and offering tailored treatment options that align with their specific needs and preferences. And at the end of the day, if you end up making sure that patients are involved right alongside healthcare providers, good education is out there on the table, this can really be helpful for a condition like vitiligo that has an immense quality of life burden and a lot of challenge when it comes to treatment as well. So let's begin. Casey, could you maybe give our listeners a little context about your experience with vitiligo? Maybe a little bit about some of the good and the bad that came along the way when it came to pursuing treatment for this condition, or even your understanding of the condition.
Sure. Before meeting you, Dr. Raj, I honestly feel like I was just going through the motions. I first was diagnosed with vitiligo at about the age of 19. Probably first started noticing the white spots on my face maybe when I was about 16 or 17, and didn't really think anything of it until they started getting larger and more noticeable, and it became concerning to me as a young adult about why these spots were appearing on my skin and why they were spreading. And I was first, prescribed a steroid cream at 19, and I took it for a little bit, but I didn't really understand what a steroid cream would do for this, or why these white spots were showing up on my skin and spreading. And I had no understanding of the disease, or what my options were, or what was even the cause of it. And so it led to a lot of confusion and fear and self-consciousness in my young adult life.
That's a very common feeling, unfortunately. Historically, medical treatment was often what we call paternalistic, where essentially it was a bit one-sided, right? The doctor would make decisions, patient would follow along. Oftentimes, there wasn't much explanation or guidance given both about the condition itself and the treatment options. And the problem is that that doesn't always work so well. And in the case of, Casey's story, you see some themes that occur quite a bit: lack of understanding about the why behind treatment, the condition itself, perhaps concerns about what might be the good and the bad that comes with the treatment. And this is where a concept like shared decision making comes in. And oftentimes that term can even seem a little hard for somebody to grasp because it sounds so high level, but really it's mainly just another way of saying partnership. Everybody should be asking questions, collaborating, and understanding what is the positive and the negative that comes with any particular treatment option and why it might be the right or the wrong choice to fit into somebody's lifestyle. And that's definitely been a driving tenet for me when thinking about my patients with chronic inflammatory diseases, including vitiligo. Maybe you can sort of detail as we move further along in your life, Casey, when we got a chance to know each other. And, when we started focusing on perhaps getting that education and partnership on the table, how did that change your perception about the disease state and your approach to treatment compared to maybe when you were 19?
Sure, yeah, it made a huge difference. For the first time, I felt like my questions could be answered. My personal experience with treatments that worked or didn't work mattered. I felt like uh, the collaboration and my own involvement in my own treatment and healthcare for once was being heard and seen by a healthcare professional with regards to this disease.
And, that's really the goal of shared decision making, making sure the patient voice is front and center in everything that we do. And it's important for anybody that really sees vitiligo that, it's not a one size fits all disease. Each treatment option is going to have its own risks, its own benefits, and patient involvement is the only way to arrive at the right approach. And one of the things I always emphasize with my patients is that there's a lot of different ways to manage vitiligo. And you heard about some of them that Casey has undergone in his life, but not every option is going to be the right fit for every person. And some patients may prioritize something that works a little quicker, something that's a little easier to handle, something that maybe is a little more safe, something that balances efficacy and safety in a different way. And so, I think that it's important for us to understand that it's all about talking about what we have and figuring out what fits. And you heard some of Casey's story. The first thing that he utilized for his vitiligo was a topical corticosteroid, oftentimes an entry level therapy to vitiligo space in general. Can you tell us a little bit more about your experience in terms of maybe anything good or the negative that came with the topical corticosteroids that you used the first time, Casey?
Uh, yeah, sure. So I used a corticosteroid about a decade ago is when I tried that treatment, and I tried it for a few months, and I honestly didn't notice any improvement. I would say I noticed some reddening of the white patches on my skin, and in addition to that, I noticed some um, painful acne on my face, and that was at that point I decided to stop taking the treatment because of the acne that was occurring. I felt like the white patches, for me personally, felt, I guess I could say I was less self-conscious about the white patches on my face as I was the acne on my face. So that was one reason I stopped taking those treatments. And then I guess at that age, I had kind of lost hope in a therapy or a solution. I know over a decade ago there weren't as many therapies available for vitiligo as there is now. So I had tried other therapies that um, were not approved by probably the healthcare field or a dermatologist, to be honest. I was trying different diets or different supplements for a while to see if those would work, and I can't really say that those helped either. So it wasn't until noticing newer white patches on my body and a slow spread of the white patches on my face that I started researching newer therapies to see if anything was available, and that's when I came to you, Dr. Raj, after reading about some newer things like JAK inhibitors online and seeing if that would be a viable option for me.
This is all a unique story, but some common threads that patients will oftentimes talk about in terms of some of the stuff they've tried. They weren't exactly sure why they were using it. It really didn't necessarily work the way they were wanting, and then perhaps phasing out of care a bit, then trying a number of over-the-counter options. And I think that's the challenge, right? Because one patient may do fairly well with something like a topical corticosteroid, then somebody may not do quite so well too. In Casey's case, he had local side effects related to acne and oftentimes deeper painful acne on the face, which is an area that you're not necessarily wanting to experience acne alongside with your vitiligo. And so that's the reason why we have to think about some of these therapies in balance. And there's other therapies out there too, just to kind of make sure everyone's on the same page. We have phototherapy, which is a narrowband ultraviolet B based option, which can be effective for widespread vitiligo, but can oftentimes be very difficult for patients to use because the time commitment's a bit of a barrier. Somebody having to come into the office 3 times a week, and occasionally we can get home units approved for use, but that can also come with its own challenges as well. We have had other topical therapies historically. Topical calcineurin inhibitors are another one as well. These are non-steroidal, which is great, but there's limitations in terms of their efficacy. And oftentimes there can be burning, stinging, tingling, and numbness associated with their use as well. And so that sort of has its upsides and downsides too. And so, Casey's journey to eventually coming to a point where we both had the chance to talk about JAK inhibitors was a really nice step through a lot of the things that he had been through. And I would not have even understood that to be the right option during our visit together unless I had really had the time to understand what worked, what didn't work, and what was important to Casey's life. And in the case of JAK inhibitors, particularly topical JAK inhibitors like topical ruxolitinib, these can stabilize disease and promote repigmentation by blocking the immune response that attacks melanocytes. And you're really very selectively targeting specific inflammatory pathways. The rapid onset has been sort of one really important part of this to my patients, but really the longer lasting efficacy with continued use has been another one too. Did you have any initial feelings, Casey, when you heard about JAK inhibitors as a medication, topical ruxolitinib as a medication, both through your own research or when we talked about it?
Most of my, I guess, concerns or reactions to it would have been about the side effects that I read about it. But then after speaking with you, um, I think one thing that I learned was that a lot of those side effects were more associated with oral dosages of this, and it was also related to treating other diseases that JAK inhibitors are used for. I had some initial concerns about the side effects and whatnot about the JAK inhibitors, but then after communicating with you about it, specifically for treatment of vitiligo, I felt more confident and assured about any kind of like immune suppression treatments.
Yeah, I think that, and thanks so much for sharing that. That's kind of exactly what I was hoping that you would come away with during our conversation together, because it's an important point. When we think about JAK inhibitors as a class, potential side effects that are very clearly spelled out on the label include increased risk of infections due to immune suppression, a few other things. And, it's really essential to weigh the risks against the benefits and then understand the context between and behind a lot of the wording that sometimes is just very difficult to interpret when you're going to go online and look at some of the information about a medication. The nice thing is that, the short and long-term efficacy and safety that we've seen both far has largely balanced with the efficacy being very positive and the safety also being very positive too. And the good news is that the long-term safety of JAK inhibitors are still continuing to be investigated as well. And so current studies continue to be really, really promising. And that is very, very exciting. And, aside from just efficacy and safety and delivery, really, there's so many dimensions to why you choose a therapy. The key is to find a treatment that not only fits the clinical needs, but also lifestyle and preferences. And we have to remember that managing vitiligo is not just about the physical aspects, it's really about feeling empowered in care. And like we touched on earlier, my goal with Casey during our time together was to really make sure he felt empowered to take control of his disease and understand exactly what vitiligo was, why we're treating it, and what we're aiming for. So, as we continue this journey together, my goal is to keep evaluating options and adjusting the approach based on what works well. And, I think that I want to turn this one back around on you, Casey, because another question that's important to me to understand, and for everyone out there listening to understand, were there particular factors that were really important in your mind when you came to see me for a treatment in terms of your list of these are the things I really want to see and these are the things I really want to avoid?
Yeah, for me, the most important thing was stopping the spread of the depigmentation, primarily on my face. I, would love to see restoration of pigment on my face and on parts of my body over time. I, was also looking for a treatment that the side effects wouldn't outweigh the benefits of repigmentation. So, for example, I was, looking for treatment options that wouldn't cause, rashes or breakouts or, thinning of skin or anything that could, potentially visually cause even, I guess, more side effects than than the disease itself, if that makes sense.
Yeah, that totally makes sense. I really think it's important that, patients set their priorities and then they share them with their healthcare provider to make sure that everybody is on the same page. And I think that me understanding where you were coming from really allowed me to meet your specific needs. And this is really the essence of shared decision making. And so, of course, for you, focusing on stopping the spread and repigmenting the most visible areas made sense. And we try to go about your goals in a very data science and medicine driven fashion. And so, for instance, the International Vitiligo Task Force released recommendations that say that it's important for personalized treatment strategies and regular monitoring and adjustment, really close tailoring of the treatment to the patient itself. And, one of the big advancements that we've seen recently with a lot of our historical guidelines, of course, is the emergence of JAK inhibitors, particularly topical ruxolitinib cream. And of course, these medications work by targeting very specific inflammatory pathways that contribute to the destruction of melanocytes, the pigment producing cells affected in vitiligo. And so, based on everything you were looking for, everything that I was looking for, and then based on just my clinical experience, JAK inhibitor like topical ruxolitinib really came to the top of our list, given the fact that it's been shown to stabilize the disease and promote repigmentation in very challenging areas that are oftentimes visible, like the face and the hands as well. And from clinical studies, we found that ruxolitinib can lead to significant improvement in severity of vitiligo, especially during the initial months of treatment, and continued improvement in their longer phases of treatment as well. And it's exciting for me to hear that, after our discussion, you were excited about the prospect of where this medication could fit in with your life and your treatment too. And that's perhaps what makes me the happiest, is that this is a really good example of a very positive outcome from shared decision making, where Casey was empowered with the information I was able to provide. And frankly, I was empowered by him sharing his story and his preferences for treatment that allowed me to help tailor down and narrow down the list of making the right decision that fit what both of us were looking for. And in managing a condition like vitiligo, which of course can significantly affect one's self-image, comprehensive counseling is vital. And it's really important to set expectations, to set a timeline, and what you might expect to see with a treatment. So with topical ruxolitinib, this may take some time to show its effects. And this is largely based on the way of the biology of skin and melanogenesis and pigment works. Many patients may start to see positive changes just within a couple months. Some might be a little slower than that. But it's that initial progress that can be a really strong motivator that provides reassurance that further improvements are possible when it comes to thinking about treatment too. And from some of the findings we've gotten from the phase 3 clinical trials looking at ruxolitinib cream, notably patients who actually had limited success after the first 24 weeks saw a large, substantial amount of gains in facial repigmentation with continued treatment. So that's where my dialogue comes in terms of really trying to provide the appropriate timeline for my patients. Can you maybe tell me a little bit more about sort of your perception after we talked a little bit about topical ruxolitinib in terms of what was the time scale that you've been operating under? As I know that you've really only recently started this therapy.
Yeah, I've been taking the ruxolitinib now for about 4 to 6 weeks, I would say. And I know it's going to be a slow and steady progress, but knowing that there is research going into continued treatments or new treatments for vitiligo is giving me some hope, and it's made it more promising, and it's given me the confidence to at least try to stick with the treatment over time, to hopefully see results in the coming months. I at first just had lost hope and trying to find treatment, but to know that there are new options available has given me the confidence and the hope to try something and to continue trying new treatments as they come available.
Setting realistic expectations are crucial. And I think it's important to be honest but optimistic in terms of exactly where your treatment plan is going and to really keep that sense of hope going. And Casey illustrated it really nicely. It's oftentimes a major challenge for our vitiligo patients that have chronically been on therapies that maybe aren't delivering what they're hoping for. And it's really the act of reestablishing hope that's an important part of this whole ball game. And a lot of that just comes from the right education, the right shared decision making, and really working together. The emotional journey, remember, when it comes to managing vitiligo, is just as important as the physical aspects. We know that there's a lot of comorbid mental health symptoms, anxiety, depression, and others with fairly high prevalence in this population. And a lot of it comes from the psychosocial aspects we think about when it comes to thinking about vitiligo itself. Additionally, trust is another important aspect of the doctor-patient relationship. And if there's open communication and really the ability for everybody to ask questions and feel like they're being heard, it fosters a trusting environment that, frankly, study after study has shown can really improve adherence. And other little tidbits that can be very, very helpful for improving adherence and follow through include educational resources. There's support groups out there. There's community engagement initiatives. Really, there is a lot if you know where to look. And that's oftentimes what the role of the healthcare provider in the patient relationship is. I like to say, if anything, you're much like a Sherpa there to help guide somebody to a treatment that's going to fit best in their life and an outcome that's really going to fit what they're looking for in terms of their life too. And the opposite, or rather the wrong way, would not only be paternalistic medicine, but misinformation and or perhaps lack of information, because that's where you get unrealistic expectations, anxiety about not knowing what to expect, not understanding why you're specifically taking a particular approach, and maybe not even understanding your disease state itself. And so it's really important for patients to rely on high quality information from their healthcare providers engaged through shared decision making, as well as trustworthy sources. And this includes dermatology associations, reputable medical organizations, peer-reviewed journals, and education and awareness through verified channels that individuals can really know is coming from a good place. And so to tie it up here, I really want to say that it's important that our patients have the right tools to navigate their journey with vitiligo. And I think if they have the confidence, if they have the hope, if they're empowered, they can really go a long way in terms of their therapy itself. Are there some final thoughts that you want to share about your journey and the progress that you've made in terms of tackling your vitiligo, Casey?
Yeah, I'll say that uh, a part of my confidence in the JAK inhibitors is the scientific research that's been done on it, and having an understanding of how the JAK inhibitors work to restore pigment of skin, and really understanding its how it works with the immune system, and not only that, but being able to see the clinical trials, or at least the statistical significance of the improvement of those, has given me more trust in this treatment and see it as an actual treatment as opposed to some of the other like anecdotal experiences and treatments out there through miracle cures or over the counter things that really have no credible information or research backing them.
Thank you so much, Casey, for sharing your story again today. Your experience really highlights the importance of shared decision-making and managing vitiligo, and I really hope it inspires my colleagues to actively participate in shared decision-making discussions with their patients. For those listening, if you missed our first episode, we explored the significance of personalized care in the treatment of vitiligo, discussing how tailored approaches can make a world of difference in managing this condition. Be sure to check it out if you haven't already. As always, remember that no decision about a patient's care should be made without their involvement. It's crucial for us as healthcare professionals to stay informed about the latest developments in vitiligo treatment and engage our patients in meaningful discussions about their care options. Thank you for joining us today, and we encourage you to continue fostering collaborative relationships with your patients to enhance their treatment experiences. Until next time, take care.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.